If you recently got a diagnosis of type 2 diabetes and you're feeling overwhelmed, then this video is for you. Or if you know somebody or you're close to somebody who recently got a diagnosis of type 2 diabetes, listen up, because in this video, I am going to talk about 5 questions you should ask your healthcare provider after getting a diagnosis of type 2 diabetes. All right. Before we jump into it, I'll just tell you, for those of you meeting me for the first time, that I'm Dr. Amina Goodwin, a physician and health coach, and I help you figure out how to eat better so that you can feel better and get on with life without having to deal with the healthcare system. All right, we'll dive into it. First question to ask your healthcare provider after they give you a diagnosis of type 2 diabetes is, what was your blood sugar test result? Like, you want to know the actual number. You don't want to just hear, oh, you have the diagnosis, because you need to know where you are right now so that you can know where you're going and you have that objective number to assess your progress, right? Now, you might be given, depending on where in the world you are, you might just be given a fasting blood test result or a random blood sugar result, right? Generally speaking, if fasting blood sugar is more than 110, that is on the high side. If a random blood sugar reading is more than 200, that's on the high side. I'm talking milligrams per deciliter, right? More than 140 to 100 to 200, that's in the in-between zone. But the fact is, it's a bit hard to interpret those readings if we don't understand exactly where the blood was taken in relation to your last meal, right? Because of these sort of uncertainties with just blood sugar readings in general, the best test would be your hemoglobin A1C test. Now, again, depending on where you are in the world, you might not have ready access to that test result, but I think it's gotten more popular, certainly in the Caribbean Islands. I'm from Antigua, and years ago we didn't have access to that, but I believe now there is ready access to that blood test. And that reading should be less than 5.4. All right, in that range, 5.4 to 6.5 is the pre-diabetes range, but 6.5 and above is an official diagnosis of diabetes. And that essentially is a blood test that gives a good idea of the average blood sugar levels over the preceding 3-month period. What happens is that glucose in the bloodstream clings onto the hemoglobin, the red blood cells, and we call it glycation. But anyway, red blood cells stay alive in the system for an average of 3 months. And so that's why that hemoglobin A1C test is a good indicator of the average blood sugar readings over the preceding 3-month period. Why I say you should know the number? Well, essentially, you could be diagnosed and your number is 6.7, or you could be diagnosed and your number is 13%, or it's 10%. You need to know where you are, because if at diagnosis your hemoglobin A1C is at 10, 13, 14%, you need to be a little more aggressive in getting your blood sugars down compared to somebody who is diagnosed and their number is at about 7%, 7.5, maybe even 8%. The management approach is different. Some people who are diagnosed and their blood sugar, the hemoglobin A1C number is just maybe at around 7% or so, they might not need to be aggressive starting medicines. Even simple lifestyle changes may be effective in somebody who is diagnosed at an A1C level of about 7%, right? But like I said, when you're approaching 10, 11, 14%, you're going to need to be more aggressive, and most likely you're going to need to start at least 2 medicines, if not more, and if not insulin as well, at least temporarily, until your blood sugar levels start improving and the effects of the lifestyle diet changes that you're going to make start showing up in your body. Okay, so you need to know exactly what your hemoglobin A1C is. You need to be able to tell somebody what that is, and you might not remember it like off the top of your head, but you need to write it down somewhere in your phone, wherever, so that you can refer to it. That test is done every 3 months or so, because like I said, the red blood cells survive for about 3 months. So there's no use in checking that test 1 month later. You have to wait until a new set of red blood cells are circulating in the bloodstream, right? So know your numbers, be informed, be aware of what is going on in your body, ask for details, all right? Second question to ask yourself right after the diagnosis of diabetes is, is there any damage to any of your organs yet because of the diabetes? We refer to that as end organ damage, right? So diabetes generally affects the blood vessels, small and large, But in the early stages, it would be more small vessel disease. And so the obvious things that the doctor can check right there and then in the office at the time of your diagnosis, three things, well, two more common than, in the office, two things in the office, and the one is a blood test, right? Or a lab test. One thing is to see what your sensation is like. Has the diabetes been lingering in your system to the point where it started to damage the nerves a little bit and your feeling is diminished? And so there's a little thing, we call it a microfilament, where the doctor can just touch the soles of your feet, the tips of your toes, the soles of your feet, to see if you can feel this thing pricking your foot. It's a dull thing, right? But it's a simple test. And if you cannot feel that thing, then the doctor would move up to where you can feel it, right? Now, if you are already having damage to the nerves and your feeling is diminished, that's called neuropathy, when you have diminished feeling, sensation, then again, you need to be a little aggressive, because neuropathy can be reversed to an extent if you get your blood sugars under control, okay? So that's something that can be checked in your office, neuropathy for damage to the nerves. Another thing that can be checked in the office, I mean, when I was, years ago, especially when I was working in the Caribbean islands, Antigua, Jamaica, and so on, we actually used to look at the back of the eyes of our patients. We have this thing called an ophthalmoscope, and we would look at the back of the eyes of the patients to see if they're having changes of the blood vessels at the back of the eye. And depending on the changes that we saw, we could tell whether or not they had early diabetic retinopathy or late, depending, right? Now, everything is very compartmentalized, so only the eye doctor looks in the eye and so on and so forth, right? But again, depending on where you are in the world, the doctor might still be able to do those things with his ophthalmoscope and look at the back of the eye to see if you are having changes of retinopathy, right? And then the third thing that you need to do, right there and then, you can supply a sample of urine to the doctor so that they can check for protein in the urine. There's not supposed to be any protein in the urine, and there's a special urine test, microalbumin test, where you can see if there's protein starting to spill in the urine. And if it's a little bit, then you can act and sort of sort things out so that the kidneys improve a little bit, right? But you definitely want to be aware if you have heavy protein loss in the urine, because that might be an indication that you have significant diabetic kidney disease or diabetic nephropathy, and you would need to be a bit more aggressive so that you do not progress to the point where you have kidney failure and need dialysis, right? So those are 3 blood tests that you can check to see if you have those signs of end organ damage, right? Third thing you want to ask is, doctor, or nurse practitioner, whoever, right? Is there anything else with my diabetes? Okay, you're telling me I have diabetes now. Do I have anything else with that, right? And one of the main things, there's so many things, right? But one of the things that's overlooked, and thankfully now the American Diabetes Association has actually put out a statement about this, saying that everybody with diabetes, type 2 diabetes, prediabetes, needs to be assessed for fatty liver disease. And so the doctor can make an assessment. It's a calculation that can be done to check your risk for fatty liver, and then depending on what's going on and so on and so forth, they will do some blood tests, do a liver ultrasound and so on and so forth. But you absolutely, with the diagnosis of diabetes, you need within the month, like soon after your diagnosis, to find out whether or not you have fatty liver disease, because that will also affect the overall control of your diabetes. And also just knowing that you have that will motivate you to be a little more aggressive up front with controlling your diabetes, and hopefully you may be able to reverse fatty liver disease. If not, when I say reverse, I mean cause it to regress, if not cure, depending on how mild it is at those stages. But you need to know about that, right? And then the fourth thing to ask your doctor, right? You need to find out from your doctor, essentially, what would you do? Like, is there anything, considering your age, right? If you're 30, right, versus 70, you can ask them, is there anything you would do for me if I was 70 versus 30, right? What would change? And what you want to do is set the stage for your doctor to know that you want to be involved in your care. And assuming you are on the conservative side where medicines are concerned, you need to tell your doctor right there and then that you're willing to do the work, you're willing to do whatever it takes to minimize the amount of medicines that you will be on now and for the rest of your life, okay? If a doctor hears that you are one who is reluctant to take medications, they will work with you. But the thing is, a lot of people like take medications, and maybe sometimes the conversation doesn't even come up. So the doctor just assumes that, okay, we'll just give a pill, we'll give 2 pills, 3 pills, 4 pills, 5 pills, right? Because you do not complain. But you are able to actually be involved in the decision about how many medicines you want. Do you want medicines? Do you have a goal to actually get off medicines because you're going to do the lifestyle and dietary changes? Take the medicines temporarily to tide you over until those changes take effect. You need to ask the doctor, okay, what, will I need to be on these medicines for the rest of my life, right? And can we work together so that that is not the case? Set the stage from day one, right? And then the last question you need to ask the doctor is, are there any vaccines that you would recommend for me to take right now? Anything I need to catch up on right now, given this new diagnosis of diabetes, right? And everybody's situation is different, but the usual ones that the guidelines would say, of course, yearly influenza vaccine, depending on where in the world you are. There's the pneumococcal vaccine. Pneumococcus is a bacteria that can cause pneumonia. People with relatively weaker immune systems are more prone to that kind of pneumonia. So diabetic patients are recommended to get that vaccine once. And then after, you turn 65, you can get one more of the vaccines, right? So that's the pneumococcal one. And then there's hepatitis B, not necessarily for older people. I like to offer the hepatitis B vaccine. It's been around forever. And for somebody who could end up in hospital, potentially exposed to blood products and so on, even though the blood products are safe, I like the idea of the hepatitis B vaccine because it's very, very effective. All of us in healthcare got it. Very effective. And hepatitis B is something that is pretty infectious, more infectious than HIV, really, very infectious. So you would hate to get something like that, which can cause even more liver problems, especially if you have a fatty liver, when, the vaccine is pretty easy, pretty benign. You can take that vaccine, right? And then also some people may consider the zoster vaccine to decrease the chance of shingles. That's usually for people over 50 years of age, right? So ask them, for your situation, which vaccines do I need to catch up on now? And then tetanus is another one as well. Tetanus, every 10 years you can get that shot to essentially, if you get a wound which gets contaminated with dirt, you don't want to get something like tetanus. Very rare condition. I really haven't seen that. I've seen it once in my life, and that was when I was in medical school in Jamaica, right? So those are the questions you want to ask up front if you're just getting a diagnosis of type 2 diabetes. You need to ask, don't just take it. It's an overwhelming condition. A lot of times people are like, oh no, and they get overwhelmed and just kind of go and, just confusion, right? So what are your numbers? You need to know what your A1C is. Write it down so you can compare when you go back in 3 to 4 months what the number is at next time you go back, right? 2, do you have signs of any end organ damage? Has the diabetes started to affect your body in any way, right? 3, is there anything else with the diabetes occurring in your body? One of the common ones, I would say, fatty liver disease. You need to know upfront immediately whether or not you have fatty liver disease. 4, do you need to take medications for the rest of your life? And essentially you want to set the stage to tell them, look, you know what, I want to be a little conservative on these. I want to take only what is necessary and I want to work with you about that. And then 5, are there any vaccines that I need to catch up on, being a newly diagnosed diabetic? I hope you all found this helpful. And if you did, go ahead and share it with somebody else who you know who might be in this same situation, or if you are caring for somebody who has type 2 diabetes and you all are feeling a bit overwhelmed. There's a lot that you can do. Type 2 diabetes is a condition that can be very well controlled and even potentially reversed, but there's a little upfront work that needs to be put in. A lot of times you just need some understanding of what is like good understanding, right? So if you like this, well, feel free to subscribe to the channel for more information on type 2 diabetes and other metabolic conditions and general health issues overall. Thank you for watching. Bye.